Hi, I'm Jarvis Odgers, physical therapist and clinic director here at Rebound Physical Therapy. Rebound is a family-owned, outpatient physical therapy clinic that has been serving Topeka and the surrounding communities since 1994. Today, we're going to continue our discussion on common sports medicine injuries. Today, we're going to be talking about the elbow. So one of the more common things that we see in clinic, particularly with overhead athletes, so volleyball players, baseball, softball, sometimes swimmers, is irritation along the inside, what we call the medial elbow, and it's irritation along one of the major stability ligaments in the elbow called your ulnar collateral ligament, or UCL for short. A lot of people will know this as the Tommy John's ligament that was kind of made famous by the pitcher who was the first one to have a reconstruction of that ligament and then return to a successful major league career. So that ligament gets irritated and sometimes torn by excessive stress. And it's typically with that throwing, or if we're talking volleyball, spiking type motion, and we take a lot of stress on that inside of that elbow. A lot of times it's pain. Typically if we're throwing, it's not only painful, but that individual will note a loss of velocity. I can't throw as hard. It hurts, but I also can't throw as hard. Treatment for that, typically conservative treatment on a sprain where that ligament is injured but not torn, responds really well to physical therapy. A lot of times when dealing with those people, it is a elbow injury, but a lot of times we end up just treating the shoulder, which has a huge impact on what the elbow is doing. So sometimes it's looking at throwing mechanics, but a lot of times it's looking at how mobile their shoulder joint is and how strong those stability muscles that surround the shoulder are. They do a huge part in deceleration of the arm, and if they're not controlling that arm, then a lot of times we put a whole lot more stress on that UCL and it becomes inflamed and irritated. A lot of times in younger athletes, you'll actually see where they get more of what they call a little league elbow, where they actually get the inflammation on the bone where that UCL attaches. Typically in a skeletally immature, so somebody who hasn't finished growing yet, their ligaments are actually stronger than their bone and the growth plate on that end of that bone. So they'll have similar symptoms, but in that case, it's not actually the ligament that's irritated, it's actually the bone and the growth plate. And again, similar course of action there. It's typically a brief shutdown on activity, let everything kind of settle down, but then it's going to be addressing any kind of strength, a lot of times posture deficits that individual has, so that we are not loading up the inside, that medial elbow, as much. Another two things that we see very commonly is what is called lateral epicondylitis, so pain on the outside of that elbow, or medial epicondylitis, also known as tennis or golf elbow. And so this is a tendon issue where that area is getting overloaded, a lot of times repetitive stress. So if we're thinking of a backhand in tennis that they are hitting repetitively over and over, and we're causing a lot of load on that outside of that elbow, and then that tendon becomes inflamed and irritated. And then you'll see it in everyday walks of life. I mean, sometimes we'll see that same thing on somebody who did a lot of repetitive work. Maybe they're doing a home remodel and they're pulling up staples out of the floor. They'll get that same kind of irritation on the elbow. Both of those respond very well to physical therapy. A lot of times it is restoring balance, making sure that the muscles on the inside of the forearm and the muscles on the outside are well balanced. That it's kind of a tug-of-war match when we're gripping something, and then if one's getting pulled on all the time, it becomes inflamed and irritated. We also do a lot of things in clinic to really kind of restore blood flow and mobility to that muscle and that tendon. We do what we call instrument-assisted soft tissue mobilization, where we're using a tool to kind of bring in more blood flow to that area, which helps your body heal itself. Another common thing that we'll do in clinic is what we call iontophoresis. where we're getting a prescription for a anti-inflammatory medication from your doctor. And then we have a device in clinic that helps deliver that medication directly to that site of irritation, which typically works really well when we're talking about one of those areas that is very superficial. You can feel on the outside of your arm and kind of feel those tendons. They're right beneath the surface. So we put a medicated patch on you and then hook it up to a machine that runs an electrical current and helps push that medication in there to help reduce that inflammation and get you kind of back in action. All right. Thank you for joining me with this series of our sports medicine.